Hi there, my name's Nadim Asaf. I'm a pharmacist working in the southwestern Sydney area. The following video will explore the relationship between medications and falls and provide you with some strategies on how to best manage your medications and stay safe. As we grow older, we might be on one or more medications. Medications come in different forms like tablets, skin patches, liquids, creams and inhalers. People who take 4 or more medications a day are at increased risk of falling. It's important to learn about the medications you're taking, since some of the medications cause side effects that can increase your risk of falling. It's also important to learn how to manage your medications to avoid taking the wrong dose or doubling up on the same medication. Ask your pharmacist whether the medication you're on increases your risk of falling. This is very important, especially when you take a new medication or when the dose has been changed. Blood pressure tablets such as Covasil, Atacand, Avapro, Norvasc, Lasix and Betaloc can cause dizziness and needing to quickly rush to the toilet. You should monitor your blood pressure and your heart rate at home or at the pharmacy. Make sure you stay hydrated and move slowly from lying to sitting positions or standing positions to allow your blood pressure to stabilise and prevent head spins or fainting. If you do feel faint or dizzy, it's important to take a moment to sit down and rest until the feeling passes. If you take diabetes tablets, you should monitor your blood sugar levels regularly and make sure your diabetes is well controlled to prevent hypoglycemic episodes or hypos, which can cause dizziness and make you feel shaky. Pain tablets such as Panadeine, Endone, Oxycontin, Targen and Lyrica can cause sedation leading to drowsiness and dizziness and a delayed reaction time. Discuss with your doctor if you could switch the sedating painkillers to those which don't cause sedation, such as paracetamol and other anti-inflammatories. You could also use non-pharmacological options such as heat, ice or TENS machines. Some eye drops such as the gel-based drops for dryness can cause blurred vision. If you use eye drops or have an eye examination, be patient and wait the recommended time sitting still until normal vision has returned. Medications to manage depression and anxiety can cause sedation and confusion. Be aware of these side effects and discuss with your doctor alternatives if necessary. To lower your stress levels, you could also try meditation and mindfulness. Sleeping tablets including benzodiazepines such as Valium, Tamaze and Stilnox can cause a daytime hangover effect, confusion, delayed reaction time and drowsiness. Sleeping tablets don't allow your body to transition into the deeper restorative sleep cycle, which then affects how well your body functions. There are other strategies you can try to sleep better before resorting to sleeping tablets. More on this later in the video. There are different tools available to help you better manage your medications and ensure you only take the necessary medications at the correct dose and at the correct time of day. It's important to have an up-to-date list of your medications. This can be paper-based and kept in your wallet or digital and saved on your phone. There are some apps that you can use to create medicines lists on your phone. Whether paper-based or digital, the medicines list should include the following information: the name of both the brand and the active ingredient to prevent double-ups, what each of your medications are for, what dosage you need to take and when, common side effects and what to do about them, and when should the medication be reviewed or stopped. It's important to learn the brand name and the active ingredient in your medication and where to look for them. The brand name is the name given to the medication by the manufacturer and can vary. The active ingredient is the chemical that makes the medication work and is the same across the different brands. One such example is the Pariase. Pariase is the brand name, whereas the active ingredient is the paracetamol in small writing. Consider packaging your medications to take the stress out of trying to remember the doses and times for each of your medications. You can use a dosette box or a medication pack. A dosette box is a plastic tray which organises your medication into separate compartments for different times of the day for each day of the week. You can fill a dosette box yourself weekly. Dosette boxes are helpful if you take between 2 and 5 medications and have time to fill them correctly each week. A medication pack such as the Webster pack is prepared by your pharmacist. The pharmacist communicates with your doctor about your current regimen and any changes that need to be made. In some instances, the pharmacist can obtain a repeat prescription when required. A small fee is usually associated with this service. Ask your doctor for a review of your medication management plan at least once a year. There are 2 different services available. One's called a Meds Check and the other is called a home medication review. A Meds Check is a government-funded service that allows you one-on-one time with your pharmacist to review the medications you are taking. The service is delivered at the pharmacy and aims to provide you with some education about your medication, how it affects your medical conditions, and to identify any problems or side effects that you may be experiencing taking your medication. Home medication reviews are conducted in your home by a pharmacist who has received extra accreditation. This review delves more deeply into your medication history and how you're taking your medication. It aims to increase your understanding about your medications and to identify areas for improvement such as replacing outdated medications. The pharmacist will provide a report back to your doctor with any recommended changes. As mentioned earlier, some medications such as sleeping tablets can increase your risk of falling. If you have trouble sleeping, try different ways to help you sleep better before resorting to sleeping tablets. You should avoid things like coffee and caffeinated drinks, going to bed on a full or an empty stomach, watching TV in bed, and daytime napping. To build good habits to help you sleep better, you should engage in physical activity, have a bedtime routine, go to bed when you are ready to sleep, keep the bedroom dark and quiet, try meditation, and if you can't sleep, read or do some quiet activity, preferably not in bed. In summary, here are some final tips to remember. Some medications can increase your risk of falling. Ask your pharmacist about your risk of falling when starting a new medication or when changing the dosage of the medication you're on. Learn strategies to better manage your medication and reduce your risk of falling. Do not take anyone else's prescribed medication, as all medications affect people differently. Do not use out-of-date medications. Return them to your pharmacy. Ask your doctor or pharmacist regularly to review your medications. Ask your pharmacy about packaging your medications in a dosette box or in medication packs. And finally, carry an up-to-date list of your medications. I hope this video has helped you learn more about the relationship between medications and falls and has given you the tools to help reduce your risk of falling and to stay safe.